All right. Yes. Good evening, everyone. Good morning. Good afternoon. Good evening from wherever you might be listening from. Good evening. I am Demilade Olufayo. I am a biomedical scientist and a digital project manager, and I'll be our host for today's session. And thank you very much, everyone, for joining us. Um, yes. This particular webinar is brought together by HealthSTEM. And in a few minutes, I would try to tell us about what HealthSTEM does before I then bring forward our speaker for today. And then we would have an interactive session, question and answer session, and then there will be a closing remark. So, like I said before, some people joined us. I said this webinar is going to be for just 1 hour. And the welcome and introduction is 5 minutes. Speaker presentation would be for 35 minutes, and then the interactive Q&A would be for another 15 minutes. If we have people that have questions that they would like to ask, and then there will be closing remarks as well. So yes, at any point, if you cannot hear me, please try and just let me know. You can, you know, unmute yourself. I have another person on the call that would always let me know when there is someone's hand up or if they have a question that they want to ask. That's the person of Tosin. So she can always call my attention. But if anybody wants to speak, please, I would implore us that we should use the raise of hand feature or the button here. Then we can you know, get called and then we can speak so that we can have the whole session very tidy. All right. Thank you very much for that. So yes, let's just get into what LSTEM is all about. So good evening, everybody. Good evening once again. Like I said, before we begin the conversation, I just want to take a few minutes to introduce LSTEM, why we exist, the problem we are trying to solve, and the community we are building. Because today's webinar isn't simply an isolated event. It presents the beginning of something actually that is much bigger than we hope to build through health STEM. All right, so when we talk about building Africa's next generation of digital health talent, what do we mean? We want to help build this next generation of digital health talent. You know, when you look at Africa, you see that we have millions of talented healthcare professionals, students, graduates, technologists, you can name it, young people, you know, who have interests, in the future of healthcare. But at the same time, we can all see that healthcare in itself is actually changing. And if you compare in the last 10 years, in the last 20 years, you will see that healthcare has actually changed, from AI to robotics to predictive medicine and all of those things, right? So you see that technology, data, digital platforms, and new models of healthcare, delivery are becoming increasingly important to how healthcare is being designed and how it's being also delivered. So, and we believe African professionals, right, shouldn't simply be observers of that transformation. I mean, if you compare what's happening in other climes to what's happening in Africa, you would see that there's actually a gap. So it shows that we should be equipped to participate in this transformation. We should also contribute to it and then, ultimately lead it, as it were. So that's actually why HealthSTEM is building a community where healthcare professionals, whether you're a student, you're an emerging innovator, we can learn, we can connect, we can innovate, and ultimately contribute to transforming healthcare. Right? I would skip the. I mean, I've said a whole lot about we're trying to learn, to connect, to innovate, and then to ultimately transform. I'll go on to my next slide, which is about Africa's digital health opportunity is growing, but who will build it? So that's a question for I think for all of us, and I think it's probably the most important question actually. behind this whole concept of health STEM. You know, the opportunity in digital health is growing in Africa, but who's going to build it? So, one of the things that we first need to understand is access. There are people who genuinely want to learn about digital health, but quality specialized education, it can actually be difficult to access, especially in a place like, say, Nigeria, for instance, where it's simply just too expensive, right? And this becomes an even greater challenge for people outside major cities, people that are find themselves in remote environments and things like that. It's really very difficult without access to, say, international programs, exchange programs, and the likes, right? So access is a big problem. Then we go to the next one, which is skills, right? So learning theory is actually very important, but when you talk about employers and innovators, they also need people who can actually apply what they know. So it's not just about, oh, let's just learn and learn and learn and learn and learn. But do you actually have the skill set to transform what you know into something that is useful? So, and as we know that there is still a gap between that theoretical knowledge and practical hands-on digital experience, right? Then we also have the third side of it, which is the exposure. So many people don't even know what exists within digital health, and that's part of the things why we actually have health STEM, right? Many people don't even know, what exists within digital health. You know, they may not know about different emerging technologies, different career paths, scholarships, fellowships, jobs, startups, opportunities available within the ecosystem. Like, for instance, there was an event today in Lagos, and it's the first of its kind in Lagos, which is a Lagos Digital Health Innovation Challenge. Right, that's the first one that Lagos will have of its kind, which is set up by the Lagos State Government. That's what I mean by the first of its kind by Lagos State Government. So, that exposure is very, very important. People don't know about many of these things. They think digital health is actually, you know, something that is still far away, but is within us. And finally, I'll talk about, there's also connection. You can have knowledge and talents, but, access to the right mentors, professional networks, industry experts, and opportunities can completely change someone's career trajectory. I'm sure you would agree with me on that. So these different four gaps, comes directly from the LSTEM problem statement, and that's one of these are the things that we actually have intentions to solve as as an organization, right? LSTEM. So I'll just quickly move on to the next slide so that I just don't bore us with a whole lot of things. So yeah, like I said, we have all of these gaps, and that's why we are building the bridge, right? We talk about from interest to knowledge to skill to opportunities and then to impact. A bridge that can take somebody from simply being interested in digital health to gain all of this knowledge, practical skills, opportunities, and all. So it's very first thing that we need to understand is we need to learn. Like what we are having today now is a webinar. Through webinar like the one we are having today, like I said, workshops and eventually specialized boot camps. We want to make digital health education very much accessible and affordable, right? So, I mean, aside from what we are doing today, in the future, we want to, look into areas like data analytics, visualization, telehealth, human-centered designs. Talk about product management, health informatics, EHRs, and cybersecurity in healthcare, and so many other things that would help us to learn about digital health. Then second one is actually to build as well. You know, we don't want learning to stop with listening to presentations. Our long-term program would emphasize hands-on skills, projects, and practical experiences. Right. Then the third one is connect. So we want to build a genuine community and connect people with mentors. So it's not just about we trying to deliver a program or we trying to deliver webinars or boot camps and the likes, but try and also build a community, right, of like-minded people, people that are into digital health, people that are into healthcare generally in Nigeria and in Africa that want to develop themselves in digital health. So then the fourth one is to discover. So health STEM shouldn't only we don't only want to teach people within our community something, but we want health STEM to become a place where we all can actually discover what's happening. Talk about careers. I've talked about it, careers, jobs, internship, scholarships, and the likes. So yeah, that's what we are trying to bridge. So going to the next slide, you would see that there is a place for you, for me, for everyone in digital health, right? So we are particularly interested in three communities, like we've said. So if you are an already existing healthcare professionals, right? Already existing healthcare professional, whether you're a doctor, whether you're a nurse, whether you're a pharmacist, a biomedical scientist, or any other allied healthcare professional, right? There are opportunities to bring everyone, you know, their their existing knowledge into technology-based healthcare. That's for sure. So in digital health is basically for everyone. Then the other category of people are students and recent graduates. So you don't necessarily have to wait until you have figured out, your entire career, even while you're still in school, before exploring digital health. There's an opportunity to start understanding the field. I mean, today's webinar basically talks about introduction, right? So it basically cuts across um, wherever, whatever stage you are in your career, basically. And then the last one is basically for innovators and enthusiasts of technology, right? We have so much enormous problem in healthcare waiting for people who can combine technology, design, business, innovation, healthcare, startup, who can combine all of these things together with an understanding of real healthcare needs, right? So I think I've been able to talk about all of the three different um, target audience that we do have. So going on to the last slide, basically, which is from learning to impact. So we are creating a pathway that turns knowledge and opportunity into real change for Africans today in the healthcare. So we don't want to measure health STEM simply by how many webinars we organize or how many people attend an event, but the pathway we are trying to create is much bigger. We want more people exposed to digital health. From that group, we want more people developing practical skills. That's basically why health STEM basically does exist, right? And we want those skills to help more professionals enter and contribute to digital ecosystem. Yeah, so that's why health STEM does exist, and ultimately, all of this should contribute to the thing that actually does matter, which is better healthcare access, better healthcare delivery, and better outcomes for African communities. So, on that note, I will welcome everyone to today's webinar, and thank you for joining from wherever you are joining us from. Can everyone still hear me? I think, yeah.
Yes, sir.
All right, thank you very much. All right, so on that note, having given that introduction, I would like to present to you our speaker for today. Um, I've known him for a while now. He's a medical doctor as well as a digital health professional, and is going to lead us into introduction into digital health. I'm sure that we have a lot of people on this call that they may have understanding of digital health. Some people, it might be your first time of understanding digital health. Some people just know digital health as being an application or a device. But on this call, we will be able to learn and get introduced to digital health. And then in future webinars that we would have, we would break digital health into different spheres and different areas. So I would like to call Dr. Godwin if he's ready. Dr. Godwin, good evening.
Okay, thank you. Thank you very much. Thank you for the introduction and also helped me to learn what health STEM is all about too. And I'll have to apologize that my slides will not be as beautiful as yours. So I'll just
Sorry.
use my plain slides to do the presentation, if that's okay. Yeah, so permit me to share my screen now. Let me share my screen. Let me make myself more visible so you can see me. Okay, so my name is Dr. Godwin, and like Demilade said, both of us we are colleagues. So, and also in the digital health space. So, and currently I'm doing my PhD now also in digital health, and also I'm also contributing in teaching the digital health module at the university where I do my PhD. So, okay, let me just look for, yes, I think. Can you see my screen now? My screen visible, right? Okay. So I'm doing my PhD and I'm also doing some work in digital health. And I also attended the African Digital Health Summit that held in Abuja. I co-chaired one of the sessions and also made some presentations. Well, I don't know how many persons here who attended that event. So I was there. And if you go to the LinkedIn page, you see one of the videos where my presentation was also featured. So let's get down to business. So introduction to digital health. First of all, before I start, I would like to say that I'm a medical doctor. Why I decided to go into digital health was I experienced a digitalization of a hospital. I was a frontline clinician, and I experienced how a hospital changed overnight just because of digitalization. And it made me to realize that digital health is not just only introducing technology or technical gadgets. It also has to do with the humans involved. It also has to do with a total redesign of workflow. That's why for you to be a digital health specialist, you don't need to know how to code. In fact, largely people who are actually leading digital transformations, they're not really that tech savvy. They don't really know how to write codes. They're not software engineers. Software engineers have their role. So also being somebody who, if you have a healthcare background, your healthcare background and your knowledge and experience has a key role to play. And oftentimes, most healthcare professionals ignore what their healthcare background can bring into digital transformation. The main interest that you have interest in digital health and you are a healthcare practitioner, either biomedical scientist, either nursing, either doctor, you are already an important asset in the digital transformation space. So it's just for you to apply yourself and see how, and understand what this space is all about. So like I said, the human is a very core aspect of it. Humans are central. Within the humans who operate these computers, who use them, makes it work. Otherwise, there will be no digital health. Otherwise, there will be no digitalization of the healthcare. So digital health is the deliberate use of data and technology to improve health, care, and health systems. Improving general health system. That even people who are in public health. Now, most of the public health modules, the digital health module I'm teaching is in a master's in public health module. So you see, that even in public health, they are not talking about digital determinants of health because digitalization is happening rapidly. So there is any public health specialist who doesn't have digital components in his portfolio will actually be lacking in the world of today. So because it's cutting across a lot of things. So the deliberate use of data and technology in healthcare, that's just simple what digital health is. So like I said, redesigning that pathway is that's where the main work is, because it's not just enough to introduce digital technology. As you're introducing it, you are disrupting workflow. Healthcare practitioners that are used to working with manual papers, when you bring a computer into the system, you are automatically telling them to go back to basics and redesign their thinking and how they work. And of course, all those things will come with the leadership that has to do. The leadership has a role to play. So, so the real work is to redesign a pathway so people receive safer, more timely, more equitable care, and professionals can make better decisions. Because when this workflow is redesigned and people can easily adapt and adopt it, that's where you now get the benefits of digitalization. But for this presentation, which is an introduction, I wouldn't want to go much deeper into some core aspects, or like just keep it within this realm, these 4 areas of explaining digital health beyond apps and devices, recognize where care pathways can improve, identify roles that connect care and technology, which is very important. There are some roles that we'll also elucidate on. Describe a practical digital health skill track. Now, this is blocking me. Let me put it down. Okay. So digital health is a system, not a single tool. It's an ecosystem. When people say digital health, sometimes when you say you're a digital health professional, it's like it's like being vague. So everybody who is in digital health definitely will have an area, a niche that they are more interested in. There are people who are just interested in AI. There are people who are more interested in their leading team. There are people who are in project management. They make all this project, this transformation processes to go on the plan. There are people who are more in working with patients to improve access, navigation, and of course, help patients to self-manage using digital technologies. Now, because digital health is a system that has many components, that is also how the professionals who are in digital health are also distributed in those areas, based on their area of need and interest. There are people who are interested in digital health devices, producing sensors, working with wearables, diagnostics. That is also a component of digital health. There are people who are the data scientists. They work with data, records, exchange, interoperability, and the rest of them. They are much more technical. There are people who are into analytics, predictive analytics, machine learning, AI, and the rest of them. All these make up digital health system, which also determine the different roles and opportunities that is embedded for healthcare professionals. So now digital capability is becoming core clinical work. Now, in the UK, for example, the NHS England has stated categorically that any person who wants to work in digital health must be registered. Now they want to now start regulating the profession. They want to make it a recognized profession. Also, even clinicians, frontline clinicians, are being encouraged to be digitally savvy. There's so much emphasis on frontline clinicians. You have to be digitally capable, meaning you just need to know the basics. You just need to be open. You just need to have that open mind to know how to use this technology. So there's that training that is ongoing, and that's what's happening now. So digital capability is becoming a core clinical work. Even clinicians are not just encouraged to just use digital technologies. They are also encouraged to also be digitally capable, because there are a lot of things happening. Workforce pressure, because the digital technology can help to reduce workforce pressure. So if it can help to reduce workforce pressure, why can't you imbibe these two skills? They are changing needs. A lot of people are getting, there's multi-morbidity. The diseases are not reducing, they're even skyrocketing. Diabetes, hypertension, the need for remote patient monitoring, and the rest of them. There's also the issue of continuity of care, where data has to be connected appropriately. So all those things help healthcare practitioners to function better. So if all these things are important, and if digital technology can help, that means it's really, really necessary for healthcare practitioners to be digitally capable. And policy and expectations, all those ones, even patients, systems, regulators, all these things are increasing. They increasingly expect digitally enabled, evidence-based led services. So that move is there, and that's why training, digital health training, is one of. There are people who just specialize in digital health training. Their role is just to train clinicians, to train healthcare practitioners of a new digital technology. And training is an important aspect in digital transformation. So remote patient monitoring is also something that has gained attention, because a remote pathway changes who acts and when. Because you have, I remember that when we did our masters, we did the remote patient monitoring project. You see how digital technology can be used to monitor somebody who is at home, somebody who is far, somebody who is located at a place where clinicians cannot actually reach, but through remote patient monitoring, through telemedicine, the person can be reached and care can be delivered. So it can be delivered at home, because delivered at home, that at home mainly is to observe what happens at home. Because there are a lot of things that cannot be observed if you don't have a monitoring system in most patients who have chronic conditions. And the observation will lead to how the clinicians can respond. And the way they respond and the outcome of the response will also lead to learning. So everything is just, the pathway is just there. And this is also a growing area that there are people who are specialized in remote patient monitoring. So if it is also something that can interest somebody could decide to just go in and create that niche for him or herself, either as an industry professional or as a researcher. So like I said, redesigning is very key in digital health. When you are deploying a digital technology, you are automatically redesigning, you are changing the way people work. So it is different from digitizing. For example, when you want to implement an electronic medical record or electronic patient record in a hospital, the essence of that implementation is not for the paper notes to be scanned and uploaded, because when you do that, you are digitizing papers. But the essence is to convert those things into electronic copy. And for you to do that, you have to redesign the workflow. You have to redesign the way healthcare practitioners work. So that's why redesigning is very key, and not to digitize the old workflow. So now, a promising idea is not evidence of benefit, because what's it called? You need to have something that you need to have a benefit, an evidence of a benefit, an evidence that the digital technology that is being deployed has an intended benefit. Unfortunately, most of the digital implementation that is going on now, it happens following this amount of excitement. People are excited to deploy technology. People are excited to use AI, to use this. But very few persons are asking the questions of how are these technologies actually benefiting or contributing to the quadruple aim of healthcare? How is it contributing to healthcare? What are the patient-centered outcomes? The outcome measure, how do you measure them? What effect is it giving? You understand? So So a decision requires evidence that matches the technology's intended purpose, level of risk, and reward context. So it's just asked not only does it work, but from whom, compared with what, and at what cost, and with what intended effect. These are things that digital health specialists and practitioners usually have in mind or are encouraged to have in mind when not only when you are deploying technology, but also when you are venturing into the digital health career. You are coming in because you want to solve a problem. And because you want to solve a problem, it will also determine your niche, the niche you create for yourself, the area you want to venture in. So responsible practice starts in the pathway design. So what is it, the purpose, use case? So there are use cases, user and intended benefits. So these are areas: clinical safety, considerations, evidence, evaluation matched to function and risk, data protection, equity, usability, human oversight and life cycle. I don't want to bore you with all these details, but AI is now taking a center stage in digital health. AI is changing a lot of things. AI is even changing how electronic medical records are deployed. AI is changing how clinicians have conversations with patients. AI is changing how decisions are made. AI just came to further disrupt the digital health space. This is why even in the digital health space, digital health professionals are expected to be 2 steps ahead, because there is a lot of things that are changing. And professionals who are in digital health are expected to double up effort, to always upskill, to always be abreast to what is happening. That's why I see a lot of digital health conferences happening here and there. There's a lot of digital health conferences. All these conferences are because things are changing rapidly. In fact, even the regulatory bodies, the regulatory bodies are struggling to keep up with some regulations, because AI needs regulation. Digital health implementation needs regulation. These are the things that are, and any jurisdiction that struggles to make good governance framework, regulations, will suffer. Will suffer because there will be digitalization, and there will be no, just like when there's no town planning, and people are just building houses anywhere, and there's no town planning. So when there's no town planning, people just build houses anywhere, and before you know it, there will be no access road to some people's houses. So that is also what's happening. So the regulatory agencies are struggling to keep up that pace, to make sure that they are able to design a proper planning for even some digital health startups and some people who are coming into digital health. So all these are very, very key. And when we are talking about AI, the human in the loop component is very key. And that's also what is emphasized during AI implementation. So what are the opportunities that exist in digital health? Like I said, digital health is like a vague term. So everybody who are in digital health have a particular niche that they are more passionate or interested in. You have the clinical informatics, and this often requires you to have some clinical background, clinically registered clinicians, especially those people who combine their duties in clinical health and their clinical duties, So, and what they do is that they improve information flow, because you cannot design any digital technology without the input of a clinician who understands the workflow. So they are there to supply that information. They are there to guide. They are there to lead. Most times they are called clinical directors, depending on the grade in which they find themselves. You can have clinical, chief clinical information officers. You'll be hearing things like chief clinical information officers. You'll be hearing things like chief nursing information officers. You see, all these clinicians are there. You have chief different, depends on the specialty, but they are the head of it. You also have people allied digital practitioners, so they have created a niche for themselves. What about people who are in product? They are the product managers, product development officers, they are there, digital health product managers, to shape how product is used, how useful the product will be. They help to design the product. And all these specialties you see, people, they work together. They work together. No particular aspect of these professionals can exist on their own. So what about people who are in safety, like the clinical safety officers? People who are, what they do is that they ensure that the digital product that is being deployed is safe and is not going to cause harm. So that is also an area that people go and create niche for themselves. It's a very important position. You cannot do without clinical safety officers when deploying any digital technology. So it could be any healthcare practitioner who decides to be interested in patient safety at any level. So people who are there to deliver, there are people who are they lead the delivery of a particular digital technology. They are there to make sure that this digital technology is delivered well, and the people who are supposed to use it accept it, and the adoption is actually encouraging. So adoption, which is usually has remained one of the challenges in digital health implementation, still remains a challenge, and it will persist a challenge. So all the factors that has to do with adoption is beyond the scope of this presentation. So now, data, there are people who are data science, data analysts, they are just there. This could be a niche, an opportunity. If you have skills in Python, you have skills in data migration, you have skills in all these things, this is also an area that you can go on. There's some universities now in the UK that offer courses in health data science and all those things, just to encourage professionals who wants to go in that area. Then user research too. You understand the needs analysis. Before any digital health implementation is done, they need to understand the needs of the people who are going to use it. So the user researcher, you will go there, and this is specialized in doing research, and also understanding the needs of the people who are going to use it, which is very important. And that needs is what determines the design, because the design cannot go on without understanding the needs of the people who are going to use it. So the user researchers will go there and do it. That is also a place that is a specialty in digital health. Then there are people who are testers, software testers or evaluators. What they do is that they test usability. They test how this, after the deployment has happened, how are people receiving it? What feedback? The evaluation information will now be fed back into the designers, the product people, the people who are in charge of product. Then it will now be compared, working in relationship with the user researchers. They can now see, because digital health technology will always have iterations. There's never a final, there's never a last bus stop. You always have iterations, people always give feedback, just like in normal software engineering life cycle. You always have iterations. So that evaluation is also there. Then there are people who are the governance people who make rules, people who are in charge of producing the relevance governance framework, ethics, AI ethics, digital health ethics, governance frameworks, information governance, how data is to prevent data leaks, to ensure that, all these are people who go more there. And now, when it comes to AI now, there's a call for more of AI safety and governance practitioners, because now the AI is spreading so rapidly, people are adopting it, but there is no control. The same thing with digital health technology. There is no control. When there is no control in digital health adoption, it's just because there's no enough governance framework to to control how people use it. And when there is no control, it can lead to harm. So people who are in governance, that is a role that is becoming more in demand now in
Yeah,
digital health.
you can raise your hands and then tell him that he has.
So, and all these roles have 4 major contributions. They improve care. Whatever role you are contributing to improving care, especially when you have clinical, that's why I say clinical knowledge is a great asset, but most people don't understand that clinical knowledge is a great asset. So you improve care, you contribute in building the products. Either you are doing a user researcher or that you are contributing your clinical knowledge or an experience, or you are there in data, or whatever it is that you're doing, you are contributing in building the product. And also, you're also helping to generate evidence, because most times there are some digital health implementation that qualifies for publication. Because now, after an implementation, there are some digital health digital health teams that publish their reports. Oh, this is lessons learned from what we have done. This is lessons learned. Oh, this is what this is what we would have done better, so that other people can also learn from it. So they are contributing to the digital health literature. They are contributing to evidence, because every act of digital transformation is an opportunity to generate evidence, because you cannot compare what happened, a case study in a particular hospital or in a particular digital health implementation environment is gold to the digital health community for them to learn from. So you are also contributing in shaping policies, standards, assurance, procurement, contributing to ethics, and also which determines how much money can be invested in digital health projects. You see, you cannot take away governance framework away from the success.
Hello, Dr. Godwin. I'm sorry to cut you off. Please, can you start rounding up so we can ask questions, because we have just few
Okay.
minutes to go.
Okay. I'm almost done. It's just the last slide.
Okay.
This is just the
Thank
last slide. Yeah. So healthcare experience is strategic advantage, like I have said. So because you understand what happens, and of course, you know what it means to when it involves patients, So, and you know the consequences of not getting it right. That's why healthcare is regulated. So this is just an encouragement for on how you're going to go about, creating depth for yourself, choosing a domain, creating a niche for yourself, and your clinical knowledge remains important. You can decide to develop your data and technology literacy. You can decide to go into product and delivery. And of course, you can decide to go into safety and the rest of them. And all those things is not just acquiring certificates, but is also to participate in real life experience of what happens in digital health implementation. So I think that is just all I have to say. Thank you very much for listening to me. If you have questions, maybe something I didn't cover, we can talk about it.
Yeah, thank you very much, Dr. Godwin. Thank you really ever so much. I think you covered a whole lot. Thank you very much for the presentation. Yeah. Do we have people that have questions? Anything that you think that you would like to ask? And then another thing I'd like to say is that also, if you want to connect with Dr. Godwin, is on LinkedIn. Just search for his name, Godwin Okeje. You'll see him on LinkedIn. And if there are anything you want, he should be able to provide. Yes, that's it, Godwin Okeje as well. Then also, you can also connect with us, Elstem, on. Our LinkedIn is not up and running, but our Instagram is. But LinkedIn is also there, but there's really nothing happening on there. But yeah, Q&A. Hopefully, because I've been trying to track this this call to be sure that we don't have restrictions to time, but regardless, we want it to be just an hour or a little bit off the hour mark. Yeah, anyone with question, if you have a question, please use the hands button, and yeah, we'll allow you to speak if you have questions, please. Okay, I think someone has their hand up. Yeah, so we'll take Uche, patience, please.
Okay, good evening. Good evening, everyone.
Good evening.
Sorry, I came a bit late, though I didn't really get everything he said. But what I just wanted to ask is all these things he mentioned some skills that you need to learn if you want to. Does it mean that you must be in the health session before you can pick one of those skills that he mentioned and learn? Or you can just learn it regardless?
Okay, so I would allow Dr. Godwin to answer that, but before it does, I'd like to say that since you mentioned that you came in late, this session is recorded, and we will try as much as possible to get the recording link for every person via email, because I'm sure that everyone that is on this call, I would assume that everyone that is on this call, we have their details, so we would send it via an email, and then we also have a post evaluation form as well that would go together with that email. So, yeah, Dr. Godwin.
Okay, fine. Thank you very much for that question. So, well, it's not only people who are in healthcare, who are healthcare practitioners that are in digital health. There are people who you can bring, people who have diverse background. They can bring their managerial skill sets in digital health. In fact, most people who lead operations in digital health are not even healthcare professionals. So there are people who are into the software aspect of it. There are people who are business analysts. They are not healthcare professionals. But the thing is that all the design that happen together with the healthcare professionals who are actually in digital health. I don't know if I answered that question correctly.
Okay, thank you very much.
Okay, thank you. Please, can you lower your hands, please, Uche, so that we can know those that are. Um, please, yeah, can you lower your hands, Uche? Yeah, thank you. So, Lamidi Solomon, please.
All right. Good evening, Lamiti Solomon. I am a therapist and also the founder of PhysioFlow EHR. So I want to ask if there's actually an advice for adoption and then trust in healthcare digital health system. So I want to ask if he has any strategy that can actually boost adoption based on new EHR system, new system entirely. So yeah, so basically that's what I want to ask.
Okay, thank you very much for that good question too. Like I said, adoption is a very big area that's, 1 hour will not even be enough to talk about. But however, one of the key factors or things that has been shown, proven to help adoption is when the needs of the people who are going to use it are explored exhaustively, and when there's a co-design. See, the problem, most of the problem is that people design something for other people to use, but without involving them in the design. When you involve people in the design, and they are not just, you're not designing for them, they are also seen. They feel that they also own it. Then when you bring, after the design, it will be easy for them. Adoption will not be a problem. You understand? Adoption is not as if that will eliminate adoption completely. Of course, you still have one or two, issues with adoption. But one of the strategies now that is being deployed to encourage adoption is to do. You hear more of co-design. The essence of that co-design is to also help with adoption. But you see, one factor that will forever solve the problem of adoption is training. when I mean training, it's not just training existing healthcare practitioners or people who are going to use digital system, but training right from changing the academic curriculum, what they learned in school before they even became clinicians to start using it. Because at the end of the day, you are producing it for the clinicians. So if they are not familiar with it, currently when digitalization came on board for clinicians, I put myself in the shoes of these clinicians, like when I experienced it first time. That's not what we were taught in school. So all of a sudden, you are bringing me computers to start using computers that I'm not even familiar. So now, when the training starts from the academic curriculum and trains a set of digital clinicians, that adoption problem will be solved. But now, co-designing and training, especially training them on the EMR, because before you even get to the stage of training, they must already be familiar with the clinical system you are introducing, because you involved them in the designing from the start. I don't know if that answers the question. I just don't want to take much time to talk about adoption.
All right.
Thank you very much, Lamidi Solomon. Yeah, so we have Oluwa Tomisin. You can go ahead with your question.
Hello, good evening. Thank you so much for today's session. My question is that for a medical student who is looking into going into digital health, specifically the data science and AI engineering parts, clinical AI engineering, would you advise that the student like kind of specializes in this, like go for a specialty? Because you mentioned something about, you emphasized the importance of the clinical acumen, and I kind of feel like there is a possibility that once you stop attending to patients or once you leave the clinical space for a while, you kind of lose that touch, like you begin to get rusty in your clinical acumen. So how would you advise such person to be able to still be in touch or still keep their clinical acumen while trying to get skills in the engineering aspect and blend the two together? That's my question. Thank you.
Okay, thank you very much. Now, as a medical student, one, it depends on the role you want to play. If you want to go squarely into data science, you want to go squarely into you want to get your hands dirty in terms of the more of the technical stuff, you may not really want to bother much about clinical experience, even though you have the baseline knowledge. But if you want to go more into some product designing, you want to go more into some clinical informatics role, you want to go more into some things that has to do with, understanding workflow, redesigning workflow. In most cases, clinical experience, having worked and experienced a hospital setting in whatever role, either biomedical scientist, either nursing, either doctor or physiotherapist, whatever role, is very important also in what you have to contribute. But if you want to get your hands dirty in terms of you want to just do data science, you want to just be cracking the data, be cracking the codes, then having that deep clinical knowledge or even experience may not really be necessary. But the fact that you have a baseline knowledge alone is enough for it. So it depends. It depends on the area you want to go into. That will determine whether, because there are some roles that when they advertise it, they will ask for clinical experience for you to, because they understand that you are bringing it in. There are some roles they don't ask. So it depends on the kind of area you want to go into. That's what to determine whether you have to go and work for some years before you now come in or you just jump in.
Okay.
Yeah, thank you very much.
Thank you very much. Okay, I think that's the apologies. I think that's the end of the questions. Thank you very much, everyone. Thank you very much, Dr. Godwin, for helping us with this session. Nice to see you again. All right, yeah, to
Yeah.
everyone that has joined this session, we want to say a very big thank you to you all. And I hope that you've been able to gain one or two things as it relates with digital health and how we can actually, improve digital health and ultimately improve healthcare, you know, whether it's the usage of the digital health or the adoption or the transformation. I hope we've been able to gain one or two things. Thank you very much for staying up to this point. So, like I said, I said that we will be sending to our mails a post evaluation form just to get to know how we found this session and some other questions that would be in there because this is like the inaugural seminar. And then we have some other ones that will be coming, which we will be bringing in people, you know, to dive deep into different aspects of digital health, just like what Dr. Godwin has been able to, just touch on. Right. So we'll be able to bring different people that have so much, skill sets, experience in those areas so that we can basically just understand. And those seminars or those webinars would also be more like scratching the surface, but it should be more focused than just this one that is about trying to introduce and trying to expose you to a whole lot of different areas that does exist in digital health. So yeah, if you haven't given us a follow on our social media handle, please you can just type healthstem on your Instagram and then follow us so that you can get updates as they come. And yeah, thank you very much, everyone. Let's have a wonderful, wonderful evening. All right, everyone. Thank you. Bye. No, 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 no. We didn't get cut off. And oh, thankfully, sir, we didn't even spend so much time. It was just short of 2 minutes. So it was well timed. Please, let me send an appreciation message to Dr. Godwin ASAP so that he knows that we are grateful. I'll send him a voice note from my own end now. Yeah, my boss. Oh no, good evening. Thank you so much for the presentation.